U.S. government announced new travel rules on Thursday because of the Ebola outbreak affecting parts of Africa. Officials said U.S. citizens and permanent residents who recently traveled to the Democratic Republic of Congo, Uganda, or South Sudan will face added entry restrictions and health checks when returning to America. The measures come as officials prepare for the opening weeks of the 2026 FIFA World Cup, which begins in less than a month. The CDC and the Department of Homeland Security introduced restrictions that will remain in place for 30 days. Health officials said they want to reduce the risk of Ebola entering the United States, while large numbers of international travelers arrive for the tournament. Dr. Satish K. Pillai, who manages the CDC's Ebola response efforts, said, "We're actively working with FIFA to ensure that there is safe traveling, safe passage, and ensuring that travelers and the American public remain safe throughout." The restrictions arrive as Houston prepares to host the Congolese national football team and its supporters. Congo qualified for the World Cup for the first time in more than 50 years. However, the team canceled a 3-day training camp and a planned farewell event in Kinshasa after an outbreak of Bundibugyo Ebola, a less common strain of the virus, spread in eastern Congo. Officials said preparations would move to another location. Congo is scheduled to play Portugal in its opening World Cup match on June 17th at Reliance Stadium. Portugal, led by Cristiano Ronaldo, enters the tournament as one of the favorites. Under the new policy, the Department of Homeland Security directed flights carrying affected travelers to land at Dulles International Airport in Virginia. Officials said the airport will use enhanced public health measures, although they have not released full details. The rules apply to U.S. citizens and green card holders who visited Congo, Uganda, or South Sudan within 21 days before arriving in the United States. The restrictions cover flights leaving after 11:59 p.m. Eastern Time on Wednesday. Homeland Security said it will work alongside the CDC to screen travelers arriving at Dulles Airport, which handles the largest number of passengers coming from those countries. Earlier in the week, the CDC announced separate restrictions that block entry for non-U.S. passport holders who spent time in Congo, Uganda, or South Sudan during the previous 21 days. The order does not apply to American citizens or military service members. CDC officials also confirmed that at least 7 Americans were exposed during the outbreak. One American doctor tested positive after working in Congo and has been transferred to Germany for treatment.
Today, the CDC held a press briefing that provided a lot of the answers and information, but we have stood up a full interagency response. The Department of State, the CDC, the Department of War, everyone is fully involved in tracking. Today, we do have and announced today at the press briefing, there is an American that is symptomatic and has tested positive for, it's the Bundibugyo virus, a strain of Ebola. That American, as well as 6 other high-risk contacts, are going to be taken out of that region and taken to Germany. We want to thank our German counterparts. That is an internationally recognized location for viral hemorrhagic fever treatments. So we're very grateful that they would take them. It's a significantly shorter flight time for Americans to receive treatment there in Germany. For all other Americans, we have issued travel warnings. We have instituted just today entry restrictions for non-U.S. citizens that have been in the region in the past 21 days. So in Uganda, Democratic Republic of Congo, and South Sudan. So very serious measures that have been taken. We are working to communicate very frequently with everyone. Your question was, should Americans be worried? Right now, there are no cases of Ebola in America. We want to keep it that way, and we are doing everything we can to support Americans in the region. Thank you, Mr. President.
The CDC issued the order under Title 42 Public Health Authority. Jay Bhattacharya, MD, PhD, the official currently carrying out CDC director responsibilities, said the action is necessary to protect the health of the United States from the serious risk posed by the introduction of Ebola disease into the United States. The World Health Organization declared the Ebola outbreak a global health emergency last weekend. The WHO data suggests the outbreak may have caused more than 130 deaths and nearly 600 infections. Health officials said the risk of a worldwide pandemic remains low, although suspected cases continue to increase. U.S. health officials continue to describe the risk to Americans as relatively low. Still, authorities have expanded airport screening programs, contact tracing efforts, hospital preparedness plans, and monitoring systems for people exposed to Ebola. Officials said the restrictions could change depending on how the outbreak develops. If conditions improve, Congo's team and supporters could travel more freely during the tournament. That's all for now from Global Pulse Unplugged. Stay sharp, stay informed, and we'll see you next time.